مرحبا بكم جميعا. Welcome to lecture 3 of the Medical Ethics lecture series. Today's lecture is about declarations. These are the instruments of medical ethics. By the end of this lecture, you should be able to do 5 things. First, explain what a World Medical Association declaration is and how it differs from a code or a law. Second, describe the core protections of the Declarations of Helsinki for research subjects. Third, describe the core patient rights set out in the Declaration of Lisbon. Fourth, identify declarations of particular relevance to psychiatric practice. And fifth, apply the correct declaration or declarations to a multi-issue clinical and research scenario. Let us begin with a scenario. A pharmaceutical-sponsored trial of a new antipsychotic is recruiting in patients with acute psychosis. Some patients lack capacity to consent. A family member offers to sign on a patient's behalf. The protocol includes a placebo arm instead of the current standard treatment. The resident is asked to help enroll eligible patients this week. Here is the question. I want you to sit with this question while we go over the lecture. Which declarations, as we're going to discuss, which declarations apply in this scenario and what do they actually require? So hold that question and we'll come back to it. This single example or scenario touches at least 3 separate World Medical Association declarations, which is exactly why physicians need to know the map of the declarations. Let us start with foundations. What is a World Medical Association declaration? It is a formal policy statement adopted by the World Medical Association's General Assembly. It sets out ethical principles for physicians on a specific issue or area of practice. There are many, over 30 World Medical Association declarations, resolutions, and statements. Each one addresses a specific, recurring ethical challenge in medicine. How does a declaration differ from other instruments? Compared with Code of Ethics, such as the ICOME, which states general duties, a declaration addresses a very specific or one specific issue in depth. Paired with national law, a declaration is professional guidance. It is not enforceable legislation, though many countries adopt it into law. And compared with a single physician opinion or view, a declaration reflects negotiated global professional consensus, not one country's or one author's opinion. How are declarations made and revised? There are 5 steps. Step 1, an issue is identified. A national medical association in a country or the World Medical Association Committee flags an emerging ethical challenge. Step 2, a working group will draft a text. The group is made of physicians, ethicists, and legal experts that work to prepare a draft language over several months of consultation. Step 3, global review and debate. National medical associations worldwide will review, will comment, and negotiate the wording of this document. Step 4, the General Assembly of the World Medical Association will vote to adopt, and that makes this resolution an official World Medical Association policy. Step 5 is periodic revision. These declarations are usually revised every few years because medicine, technology, and societies evolve. This is why Helsinki, which was first adopted in 1964, has been revised 9 times, most recently in 2013, while Geneva Declaration was revised in 2017. So why do declarations matter? Give kind of a soft law. Well, there are 4 reasons. Reason 1 is that they represent professional consensus. They represent negotiated agreements across national medical associations worldwide, not only one country's view. The reason is that they are like a bridge into national law, because many countries will incorporate World Medical Association declarations directly into research regulations and medical council codes. The third reason why declarations do matter is that they are a defensible standard. Following a declaration provides physicians with a recognized, citable standard of care in disputes or in reviews. And then the last reason is that they are a common professional language. Declarations let physicians worldwide reason from the same shared starting principles across very different legal systems. So here is a map of the declaration family by theme. There is a foundational pledge, which is the Declaration of Geneva, and this represents doctors' or physicians' modern oath. There are research ethics, the Declaration of Helsinki on human subjects research. There is patient rights, the Declaration of Lisbon on the rights of the patient. And there is vulnerable and detained persons, the Declarations of Tokyo and Malta on torture and hunger strikers. We're going to take each one of these in turn. So the foundational pledge, which is the Declaration of Geneva. This states, quote, I will practice my profession with conscience and dignity. The health of my patients will be my first consideration, unquote. And this is a declaration that was adopted in 1948, immediately after World War II. And most recently, it was revised in 2017. In brief, it commits physicians to 5 things: to dedicate their life to the service of humanity, to respect patient autonomy and dignity, maintain the utmost respect for human life, not allow considerations of age, disease, belief, origin, or other factors to intervene, and maintain confidentiality even after a patient has died. Also use their medical knowledge to avoid using their medical knowledge to violate human rights, even when a physician is under threat. So if we turn to research ethics, the Declaration of Helsinki has core protections through 4 principles. These principles are favorable risk-benefit balance, which means a study may proceed only if there is anticipated benefit and that justify the risks and burdens to the participants. Then there is independent ethics committee review. Every study protocol must be reviewed and approved before it begins, with no exceptions for urgency alone. Then there is free and informed consent, which means consent must be voluntary and adequately explained, informed, and it has to be given, the consent has to be given by a person with capacity or their legal representative if the patient does not have capacity. Another principle is scientific soundness of research. Research must be based on sound scientific knowledge with a clear and answerable question. Vulnerable groups and special situations. The Helsinki Declaration covers vulnerable groups and special situations. On vulnerable participants, these are groups of patients who have diminished capacity to protect their own rights, including patients with severe or acute psychiatric illnesses. They have to receive specific protections. Research in such individuals must be justified by their health needs, the health needs of that specific population. Research cannot simply be more convenient to conduct on them because of their mental illness. On the issue of placebo use, it is strictly and tightly controlled. Placebo may be used instead of a proven treatment only where there is no proven intervention that exists, or where there is compelling scientific reasons to justify using placebo, and the participants will face no risk of serious or irreversible harm from using placebo. Withholding a proven treatment for study conveniences is not permitted. Let's turn to the rights of patient. The Declaration of Lisbon articulates 4 rights. The right to self-determination, which means free choice about health care, including the right to refuse or discontinue treatment. The right to information, which means full, understandable information about a patient's diagnosis, prognosis, and treatment options. And then the right to confidentiality, which means protection of personal and medical information even after death. Finally, the right to dignity, respectful care, relief of suffering, and support in dying patients. Support them with dignity. Let us recap on the declarations of Tokyo and Malta. The Declaration of Tokyo sets an absolute prohibition on physician participation in torture or cruel, inhumane, or degrading treatment, even under orders or threats to the physician personally. The Declaration of Malta gives guidance on respecting the autonomy of competent, informed hunger strikers. Force feeding of a capable refuser is inhumane and degrading treatment, and it is not permissible care. Some declarations are especially relevant to psychiatry, like the Madrid, the Hawaii 1, Hawaii 2, and also the Malta Declaration in psychiatric settings. I'm going to go over this slide because we want to focus on general principles that are not specifically applicable to psychiatry. So I just wanted to put this slide on to mention Madrid and Hawaii declarations. We want to talk about declarations on end-of-life care. Venice and euthanasia. The Declaration of Venice on terminal illness stated that physicians are not obliged to prolong suffering or use extraordinary means where a patient is terminally ill. Relief of suffering remains a paramount duty, even when cure is not possible. Symptom relief must not be withheld because of fear that it may hasten death or make a patient possibly face death sooner, provided the intent is relief and not termination of a patient's life. The Declaration on Euthanasia and Physician-Assisted Suicide states that the World Medical Association position on this subject, euthanasia and physician-assisted suicide, is that this practice is unethical and physicians should not participate even where this is legal in a specific country or jurisdiction. Now, this opinion remains contested among national medical associations because in some countries euthanasia or physician-assisted suicide is legal. However, the general consensus, according to the World Medical Association, is that this is unethical and physicians should not participate in this. Here is a broader survey of other notable declarations. I'm just going to go over these quickly. The ones that we covered earlier are more important. However, these are relevant because, for example, the Ottawa Declaration focuses on child health, the rights of children to health care and to be shielded from harm within healthcare systems. The Declaration on Environmental and Health, or Environment and Health, this basically talks about physicians' responsibility to address environmental threats to population's health. And then there is a statement on domestic violence that provides guidance on screening patients for domestic violence, what to do and how to report, and what are the reporting obligations. There is also the statement on access to health, caring for equitable access as a professional responsibility, not only a duty on governments or states. So just know about this, but we want to focus on the things we mentioned earlier in previous slides. So are these declarations legally binding? 4 things to consider. First, they are not directly enforceable. So World Medical Association declarations in itself or in themselves, they do not create a court enforceable obligation because the World Medical Association does not have power to prosecute violators. Still, some countries do adopt declarations into their own laws. For example, many countries have written Helsinki's protections directly into their research regulations, making them legally binding in that country. Declarations are ethically binding regardless of their weight. Professional bodies and licensing authorities in different countries can still use these declarations as grounds to discipline physicians who depart from the declared standards. These declarations represent a floor and not a ceiling, meaning in some countries, national guidance or institutional policy will set more strict standards than these declarations, and in these countries, the stricter standard actually applies. How do we close the gap from declaration to practice? In 3 ways. Institutional policies translate these principles into procedure, like hospital ethics committees, internal review boards. They convert declaration language into concrete protocols and consent forms. Second, training builds recognition. That's why physicians and residents learn to recognize when a clinical situation triggers a specific declaration. And these are the skills that this lecture series is trying to address. Then there is professional judgment. So physicians' professional judgment fills part of the gap. The declarations give you principles, not exhaustive rules, and physicians must use their own clinical judgment, reasoning, from principle to a specific clinical case. So let's go back to the case study. That there was a scenario that governed chiefly by the Declarations of Helsinki, applied through the lens of the Declaration of Lisbon's patient rights framework. So if you apply the principles of those 2 relevant declarations, first of all, capacity must be formally assessed for each patient who is going to participate in that study. Getting the consent from a family member, who is referred to as a proxy, will only be acceptable or valid when the patient's truly do not have capacity, and that has to be documented. Whenever you take consent from a family member or a family proxy, you must follow applicable legal framework for what is called surrogate decision making. Surrogate is basically someone who replaces the patient in making the decision or giving you consent. The placebo arm of that study will only be defensible if there were no proven treatment, and that treatment has not been withheld from patients. So in that specific study, if there is a well-known or established treatment, it is not acceptable to use a placebo. Vulnerable group protections require that studies address a specific need to that population, not just convenience for the authors of the study. Every enrolled patient will retain the right, as expressed by the Lisbon Declaration, to withdraw at any time without prejudice to their ongoing care. So let us close with the key takeaways. A World Medical Association declaration is a specific negotiated policy statement. It is more detailed than a code, but less binding than law. Geneva is the physician's pledge. Helsinki governs research. Lisbon sets out patient rights. Tokyo and Malta protect detained and coercively managed patients, which also relates to psychiatric practice. Madrid Declaration and declarations of Hawaii, Hawaii II, speak specifically to the ethics of psychiatric practice. Declarations are soft law, ethically binding on physicians, but professional judgment is still required to apply them. Thank you.